And then the Healthline settlement, and this is the most recent one that we're all paying attention to. There's a lot of different takeaways here. One of them, though, is that it appears to us that the regulator may be looking to stretch the definition or the application of health data to inferential data. They have this analysis that they were tracking what individuals, what articles the individuals were reading within the Healthline ecosystem, and then sharing that with third parties, whether the reader had opted out or not. So they didn't respect that. But one of the things that was curious was if you search for like what do I do for this disease, they were inferring that meant you had the disease and therefore it's health data. We've seen this elsewhere, including in Washington State. Something to be very mindful of as we look at our websites. We might not be a PHI or a HIPAA covered entity, but we might be dealing in sensitive data based on the regulator view, which would obviously, I think, Val, require heightened sensitivity with respect to our tracking technology awareness and consent modules or anything else that we're using. So
Yeah,
just a few other practical takeaways.
absolutely. And I think the one or two things to wrap up with here is the health piece. Washington, my data's grace period ended this year, which was a response to Dobbs. So healthcare data became much more important around tracking technology. And then with things like healthcare and even beginning with Sephora, it started to become kind of clear that there is extra sensitivity around that. And I think that the way to think about that, the articles being shared, Scott, is that tracking technology is, relatively speaking, not super high fidelity, which is why session replay is such an issue, because it's
Yeah.
higher fidelity. By sharing an article, I would think that they're probably viewing that as a higher fidelity tracking, where now you have all this context that you were maybe missing through, more basic technologies like, if somebody clicked on a button or something like that. But we're going to continue to see that, I think, kind of nationwide. Like I said, particularly in response to Dobbs, you're seeing copycat laws from Washington My Health. You're seeing the Healthline decisions. Like it's not going to go away. It's going to continue increasing. And if you are health adjacent, I think this is your warning call if you're not paying attention that health adjacent businesses, pharmacies, cosmetics, anything that's related to healthcare in general is something that you need to be thinking about in terms of what are you doing for tracking and privacy management.